Movember is a movement where men will grow a mo or mustache during November to spark conversation around men's health, particularly in the areas of prostate cancer, testicular cancer, mental health, and suicide prevention, all to keep men from dying before their time. And with us this morning is Illinois State Rep. LaShawn Ford. I know you're also a prostate cancer survivor, and Dr. Adam Murphy, a urologist at Northwestern Medicine and Assistant Director of Community Outreach and Education at Lurie Cancer Center. Thank you, gentlemen, both for joining me this morning.
Thank you, Tia.
Well, let's start. Thank you both. Yeah, let's start out with Dr. Adam Murphy. Why is it so important for Black men in particular to get tested for prostate cancer early?
While 1 in 8 men in the United States will get prostate cancer, it'll be 1 in 6 for African Americans. And that difference is one issue about leading to increased risk of death. But if you catch it early, the death rate from prostate cancer is 1%. If you catch it later, it goes down to 75% when it gets advanced. So screening every year, starting at age 45, really helps Black men, even more so than other men, beat this disease, who can do it maybe even every other year. So annual screening with your primary care doctor is important.
The key word there you said was screening. Dr. Murphy, how easy is it for the screening and to get tested for prostate cancer?
It is a simple blood test that you use, that you should take, called the prostate specific antigen or PSA test. And it can be done within a day and the results will be back to you. The only trick is that it needs to be interpreted by someone who knows what they're doing, because a big prostate, sexual activity before the PSA is drawn, or even infections can cause the PSA to rise. So it really should be done with a doctor as often as possible.
All right, good information there. Let's bring in Representative Ford. I know you're sharing your own personal story as a survivor of this particular cancer. Can you talk about your journey and how you even found out that you had prostate cancer?
Yeah, it's about personal, diligence. The mainstream science will tell Black men that you don't need to start screening for prostate cancer until you're 55. So the United States Preventive Service Task Force says that men should not start screening until they're 55. But for me, I actually was diagnosed with an aggressive prostate cancer at 48. And that diagnosis came because I wanted to have my own prostate screening from a doctor. But of course, the doctor would say that you don't need it until you're 55. I'm so grateful that I have insurance and that I was able to get a PSA test that actually revealed high-level PSA.
Let's talk about Thursday's event, because I know Thursday you have an event where you want to bring awareness to this. Either one of you can answer this. Tell us what people will experience if they come out to this event on Thursday.
Well, we have a lot. We've been partnered with LaShawn Ford on other events as well, but this Thursday is at Near North Costner Health Center from 3 to 6 p.m. And there will be people doing, obviously, PSA screening and talking about prostate cancer screening and prostate health. But people can also learn about nutrition, in line with the last segment on kind of things that extend your life. There'll also be free men's haircuts. And there's a town hall talking about men's health as well. So our team will be there helping out.
Yeah, it's a whole collaboration of Near North Health, Northwestern Memorial Hospital, Aetna Medicaid, Hers Barbershop, and really just dealing with men's health. I mean, we have to make sure men understand that their cardiovascular health is important, watching that cholesterol, watching their mental health, watching all the things that could actually extend your life. And that's what Movember event is about.
All right, and we definitely appreciate you being here. The address was very thin up there on the screen, but it is on North Costner Avenue. I appreciate you, Representative LaShawn Ford and Dr. Adam Murphy, for joining us this morning, talking about this really important topic that definitely can have an impact on our community. Thank you so much for being here, to both of you.
Thank you.
Thank you.
Thank you.